Hey, what happened to your thumb?
Motorcycle accident.
Are you serious?
I mean, I was taking apart my motorcycle and
Oh, God.
the wrench slipped.
I was like,
So it's kind of a motorcycle accident.
Oh my God.
Hey guys, welcome to this week's Go Headquarters podcast. I am Brandon Rada, and with me today is Dr. Catherine Rada. She's a physical therapist here and doing some great work here out of Go Headquarters. So we want to get to know her a little bit today and see what she has to offer you and how physical therapy pertains to you here at Go Headquarters for any of you broken down athletes. Catherine, kick off by telling us a little bit about your background. How did you become a physical therapist? What got you into that?
Okay, well first, thank you for having me on the podcast, Brandon. I
Thanks for being
appreciate
here.
the opportunity to get to talk about what I'm doing. I am a physical therapist, as you said. I'm from Charleston, South Carolina. I got my undergrad in psychology, my degree from the College of Charleston, and then I moved to St. Augustine for PT school. And I got my graduate degree from the University of St. Augustine in 2012. And then I went on to get my manual therapy certification last October from the university as well. And then just worked around the area and decided I wanted to start my own business. I was a little frustrated with the way things were going and in the insurance world, and just decided I was going to open up Revive Physiotherapy. So that's how I got here.
Awesome. And just to add to that background, Catherine is pretty much a lifelong athlete. She runs, she lifts weights. She's been a Fit Camp member for a while. So one of the perks of her being a physical therapist is that she is one of the active ones, whereas sometimes we get into the kind of the medical world and community and they maybe aren't the most active, so they're inclined to prescribe things a little differently. So one of the things Dr. Rada here can appreciate is people wanting to still kind of continue on with their fitness journey. So we're going to get into that a little bit later.
Absolutely.
As a physical therapist, what is it exactly that you do? A lot of people don't really know what physical therapists do in their daily routine. How does that differ from something else in the medical world? Can you elaborate on what it is that you do?
That's a good question, Brandon, because I think a lot of people don't know what physical therapists do. We specialize in the assessment and treatment of musculoskeletal injuries and dysfunctions, and I also have gotten into helping people with their mobility. So I do one-on-one mobility sessions as well, just to help people start to move a little bit better. So anytime you're feeling like you have some tight joints or stiffness, I'm the person to come to.
Okay. So what's an example of a musculoskeletal injury? If somebody tweaks something, do you have a recent example?
Oh, sure, yeah, absolutely. Rotator cuff tear. I see sometimes, we're in here, we're overhead a lot, or just impingement of the shoulder, we see that a lot, or just low back pain in general. I mean, there's so many things that you could come up with, disc injuries, ankle sprains. Sometimes we are running and we tweak our ankle a little bit, and so I'm the person to come to if you're having one of those weird aches or pains, or maybe if you have something chronic that's been going on for a long time and you just can't seem to kick it and it's kind of limiting your progress in here. That's something that I would be the person to come to and talk to about, and I could probably, get you back to doing what you were doing before, and you'll have some tools to treat it in the meantime.
Okay, right on. How is it that, so most physical therapists, in my experience anyway, are operating out of some sort of a clinical setting, right? Mm-hmm. Like a dedicated physical therapy type of office, which you've got experience doing, of course. But how is it that you're now here at Go Headquarters practicing here? Can you talk about that progression?
Well, like I mentioned earlier, was really frustrated with kind of insurance companies and business owners sort of dictating what I did, because I wanted to really do something different with what I wanted to do with physical therapy. So I really wanted to bridge the gap between physical therapy and fitness, and I really couldn't do that. Insurance companies were kind of like, we're not going to pay for you to get somebody to overhead squat 250 pounds. They don't care. But I care, because I'm here doing this. I'm here sweating with everyone, and I know how much I love it and how much the members love it. And that's why I wanted to bring it here. And so many people were coming up to me throughout time, even when I was in school, and they were saying, I I have this thing going on, is this ache, this pain in my shoulder, what do I do? This ache in my back, what do I do? And I thought, well, what a perfect opportunity for me to bring it here and have this available for the members.
Yeah, and everyone, all day, every day in here or anywhere, when you're using your body, you're going to get tweaks, you're going to get some aches and pains and things.
Oh, absolutely.
And there's no real way around that, especially if you're pushing yourself consistently.
Yeah.
So it's great for us as trainers and coaches to be able to say, hey, go see Catherine, have her kind of do some sort of assessment, take a look at it, see what we can do. And we work hand in hand with her to kind of modify anyone that's on a restricted list if they're having a shoulder thing and we need to modify their workouts to pull them off of that based on their restriction. We're working hand in hand to make that happen, as opposed to a lot of my experience in the past, unfortunately, with physical therapists, is we're actually butting heads because the therapist will want you to just be on complete rest,
right?
Which has its place. You know, there's a time and a place to do that, but a lot of those therapists that are not active athletes themselves and aren't in here doing the things we're doing don't get it.
Yeah, they don't.
In short.
Unfortunately, they don't, and I think they don't understand what we do as much in here as maybe somebody who does do it. And it's my goal not to shut everything down. I always want people to be able to continue. We just have to modify things. We have to change it a little bit so that you can get out there and still work out. Because I think the worst thing you can do, and so many studies have shown that, is just to be immobile. You need to move, even when you're injured. So, I mean, if you tear every ligament in your knee, I might tell you, oh, you might need to, shut it down for a little bit. But
sure, that'd be the time to do it. Okay. Well, with that being said, I'm hurt. I'm tweaked. How do I hire you? What do I do? How do I get in touch with you? What are my steps? What are those procedures going to look like? Can I use my insurance? Do I need a doctor's referral? Give me some of those answers.
Okay, so those are all good questions. I am an out-of-network provider, so that means you come to me, you pay, and then I give you an invoice to submit to your insurance company for reimbursement. So it's a good idea to call first and see if you have out-of-network benefits for physical therapy. But you know, a lot of people also use their health savings plans. There's different options we can talk about when you come in. And then as far as a doctor referral goes, no, you don't need a doctor's referral for 21 days in the state of Florida. I can treat you without a referral directly. So if you have an injury, you can come straight to me. You can always get in touch with me. I'm usually here running around, so you can always come talk to me, grab me anytime. My business cards are in the office, so my phone number, my cell phone number, you can call me directly, is on there. And also my website, revive.physio, has all the information for you to sign up. You can actually book an appointment online. There's a schedule an appointment button for you to push, and it'll show all the times that I'm available, and send me an email and let me know. It's really that easy.
Yeah, and if you're ever here at Go Headquarters and you just need one of her cards or her contact info, obviously see one of the coaches. We have all that info to get you in touch with her one way or the other. So, Dr. Rada, thanks for joining me today.
Thank you, Brandon.
And good luck with Revive Physiotherapy.
Thank you.
Hope to see that thing blossom as time goes on.
I hope so.
Thanks for viewing with us today, and we'll see y'all next time.